I'm Helen Farmer. You're listening to Dubai Eye 103.8, and it's our second competition of the day. The Dubai Fitness Challenge is underway, and I want you to help, get your 30 and 30 in. So I've got a pair of entries for Try in the Sky. It's at the gorgeous Aura Sky Pool, and the chance to win a luxury night staycation to recover as well. So incredible prize, staycay and Try in the Sky. That's going to be taking place on November 15th. So it is, as the name suggests, a trio of sporting challenges around the infinity pool and the amazing views of the Palm as well. If you fancy winning that, just tell us, in what year did Emirates Towers open? Jumeirah Emirates Towers, it's one of my favourite buildings of the skyline, but when did it open? Was it the year 2000 or was it 1990? A or B, 2000 or 1990, text me that number and your name to 4001 or the app or the WhatsApp, which is 048715500. Also, the way to get in touch if you've got any questions for our vets in the studio. We'd love to hear from you. Let me know that number and you could be winning an incredible prize with me today.
This is Afternoons with Helen Farmer on Dubai Eye 103.8.
Sponsored by Modern Vet, pioneering surgeries and raising veterinary standards across the UAE.
This is a whole new world for me. Knee replacements for animals, custom braces, prosthetics. Dubai's pets really are benefiting from some cutting-edge technologies and advancements that maybe were once reserved for us humans. 3D printing, specialist rehab. It's kind of transforming the ways our cats and dogs in particular do recovery from injury and disease. So we're bringing in the experts to tell us what is new and what is next when it comes to animal orthopedics. We have got Dr. Moustafa, orthopedics specialist, and Megan Taylor, who is a veterinary physiotherapist at Modern Vet. Thank you both for being with us today. And I wish I'd known you a decade ago when I had a dog with arthritis and we just didn't know what to do because it felt like, we gave her the meds and we'd run out of options. But it feels like even in a decade, so much has changed. Dr. Moustafa, when we think of orthopedic surgery, we do think of it as being a very human medical field. Yeah. How has it evolved in veterinary care? What kind of cases are you seeing in Dubai now?
Like in the past decade, veterinary orthopedics has evolved massively. We're more now into the technology of the human surgery. Not like before, veterinary surgery was quite outdated in comparison with human surgery. In Dubai, we have more of toy breed dogs. We have specific breeds that is not common as in Europe or in other countries because of our indoor lifestyle. Mm-hmm. So we see a lot of Pomeranians, Yorkshires, we see French bulldogs, we see Italian greyhounds. We see more of these tiny guys, and these guys they're having a lot of specific issues.
Okay.
So our day-to-day problems that we see in Modern Vet are knee issues in these guys. So we see a lot of kneecap dislocation, or we call it patellar luxation. That's our routine surgery every day now. It's quite common and it's underdiagnosed. So mostly the owner is not aware that the dog is having that kind of a problem until it really kicks in hard and they start to be obviously painful. As you know, they hold the pain really good. Mm-hmm. So we see also a lot of other trauma issues with these guys because of their fragile bones. So we see a lot of forearm fractures. We see ACL injuries, cruciate ligament injuries. We see even combined injuries like patellar issues with CCL issues or cruciate ligament issues, 2 in 1. We used to address it in the past 5-10 years in a different way, but now we have new implants, new technology to address that.
Wow, this is why you need a specialist.
Yes, exactly.
Megan, we've spoken before, and I love the social media content that you put out there because I think who doesn't love a recovery story?
A heartwarming story about a cat walking again.
But it is though, because we can talk about conditions and treatments, but really what we're talking about is hopefully recovery and a new lease of life. For anyone that isn't aware, what does veterinary physiotherapy actually involve and how does it fit into that recovery plan after a surgery with, Dr. Moustafa or a neurological surgery even?
Well, yeah, we work really closely with the orthopedics or neurosurgery because a lot of people kind of have this idea once you've done the surgery, we hope for the best and the dog just kind of continues the life again. But actually there's so many steps of ensuring that healing happens properly and to kind of grading them back up to the full exercise that they can do. especially after neurosurgery, sometimes they will remain paralyzed. And it's kind of, you don't just hope in a few weeks they just stand up and start walking again. You have to stimulate the nerves, stimulate the muscles, try to retrain their gait, teach them how to walk again. So we have a lot of techniques that we can use to try and help that. We use laser therapy, we use acupuncture. We recently added like hydrotherapy to the clinic. So it's walking underwater in a treadmill. So the water kind of alleviates the pressure from the joints and makes them kind of weightless. So they're able to kind of practice these gait patterns to learn to walk again.
Oh, what a rewarding job.
Oh, I love my job.
I can tell. 3D printing, Dr. Moustafa mentioned there, prosthetics even. It does sound really futuristic.
Yeah, it is.
Has it become quite everyday? And what difference does it make for pets? When you're trying to decide if a candidate is good for this kind of outcome, what are you looking for?
So we're using 3D printing like recently a lot in veterinary orthopedics and even in physiotherapy. So there is like conventional standard implants that we can buy for prosthetics, like as I told you, for knee prosthetics or hip prosthetics, which is quite common to see arthritis in the knee or in the hips, and it's end stage and we cannot do much unless we change the joint to preserve the function. But now with the new technology, we can do like custom-made 3D printed prosthetics that's perfectly fitting the patient, and it cuts the surgery time. It comes with specific patient guides to make our life easier as surgeons, which reduce the anesthetic risk, make everyone's life easier, and enhance the recovery. And then Megan's job is also easier with the prosthetic, with the recovery.
Oh, that's amazing.
With the physiotherapy part, we also have, we introduced a new service recently with Megan to do a 3D printed custom-made orthotics. So if the patient is not a candidate for surgery and they have like instability in a joint or something, and we're using braces, with the conventional braces, we used to see like a lot of skin irritation. The animal is not happy, they are biting it.
Or even in Dubai, the big issue is none of these companies are in Dubai, so you kind of send away a prosthetic to do like a casting, and then it comes back and it doesn't quite fit, and then there's a lot of back and forward where it's not quite working.
Yeah.
So now it's like a 3D scanner that takes an actual scan of the leg. So we have like the video, we have all the measurements, and usually once we've done that, it's pretty much perfect fit.
Yeah.
That's incredible.
Yeah.
It really, I mean, that really must be wonderful to have, because traditionally, as I said, we had an elderly dog who had arthritis, and it was very much about pain management.
Yeah.
And I do think, because we did adopt her when she was 8, but if we'd started to look for some of the warning signs a bit earlier, things that we could have done in terms of lifestyle as well. We talk all the time about, what we should be doing for our own bone density and bone health as humans.
That's true.
What about in our animals? Is there anything that we could be doing earlier on? Not as lovely as you are, Dr. Moustafa, to maybe stay away from your surgeon's table.
It's really important to catch these problems like early, especially that for you as a pet owner, you will feel it. Like your dog is not really happy to get out as he used to. If you have a cat, she wouldn't be happy to jump over. She doesn't do zoomies anymore. She's not climbing stairs. So you can feel like there is something wrong with them. And then in these cases, it's not only about surgery. It's about rehab, physiotherapy,
Weight loss.
weight management. That's really important.
For prevention for arthritis, the best thing you can do is weight loss.
So we have an 8-year-old spaniel right now. Shout out to Lucy, who she was definitely getting a little bit thick, and she was a curvy girl, and we took her to the vet, and she's taken 3 kilos off. And we literally said at the weekend, as we released her for zoomies in the compound, we were like, I cannot believe the difference that 3 kilos had made.
But we feel like 3 kilos isn't that much, but then you're thinking of like a 10, 20 kg dog, and it's a huge percentage of the pressure is now off the joints.
She went from 15 to 12, and it probably took, made her 3 years younger. And we are using some supplementation as well.
Yeah.
But it was really, really noticeable. So weight management is key then.
Like the recent studies about these joint supplements, it's surprising. They're not really doing much. Like from evidence-based data, there is not much data about the effect of these chondroprotectives. I think it's only satisfying the owner that I'm doing something for my dog or my cat. But actually, what's really helping is the weight loss. It's the physiotherapy, pain management. But these supplements are not really of much of help.
Maybe these save me 100 dirhams.
Yeah.
What was interesting is I think none of us had realised that everyone in the family was giving her a little treat from time to time. And when there's 5 people doing that, then the 3 kilos went on pretty darn quick. We are keeping our experts, Moustafa and Megan, in the studio. If you've got any questions about orthopedics in particular, about physiotherapy, do reach out. Debs wants to know more about hydrotherapy. She's asking, is that something I could do with our old retriever in our pool? And we're going to talk about cats as well. So if you've got any questions, please do get in touch. You can do that anonymously, or you can give us a call. Same number as the WhatsApp at 04871 5500.
Dubai Eye 103.8 traffic.
Sponsored by Yas Island Abu Dhabi. Stay at iconic hotels and play at record-breaking theme parks. Book now on yasisland.com.
Jen, it is 2:15. How are our roads looking?
Not too bad at the moment, certainly not in the southern part of the city and in Abu Dhabi. Once we head sort of further north in Dubai, I've got 2 accidents right back to back on the D71. That's Financial Centre Road, but as it passes across the water at Dubai Design District. 2 accidents literally right next to each other, so one to watch if you're heading towards the coast there. We've got a bit of congestion on Sheikh Zayed Road in both directions in the northern part of the city, and then once we get north of the creek, we've got a couple of accidents on the 311, one alongside city centre Mirdif on the northbound carriageway and one on the southbound carriageway alongside Muhazina 4, so it's busy in both directions there. There's also an accident on the S116 just before the junction with the 311 causing some problems. There's an accident on the D89 in front of DXB right now as well. And then on the Sheikh Zayed Road, we've got an accident on the northbound carriageway alongside Al Nada Park just after you've crossed the border into Sharjah. That one's causing quite a bit of congestion. It's actually busy in both directions on Sheikh Zayed Road there. Other than that, not too much to report. There is another accident just appeared though on the map on the 611 northbound carriageway through Sharjah. So another one to watch out for if you're heading north. Anything else that I've missed, please let us know. 4001.
Thank you, Jen.
Dubai Eye
103.8.
And already messages coming in for Dr. Ash. We're talking men's mental health after 3 o'clock today. Maybe it is someone in your life that you're worried about, or perhaps it's you and you just don't know what therapy would even involve. How do you choose the right person? And what happens when you walk through the door? We're unpacking all of that and more from 3. If you'd rather get a question anonymously, that's fine. Use the same numbers, but if you do fancy a chat, you can, of course, reach us here in the studio.
More of Afternoons with Helen Farmer is coming up next.
on the UAE's
It's Miles Smith on Dubai Eye 103.8, 25 minutes past 2.
This is Afternoons with Helen Farmer on Dubai Eye 103.8.
Sponsored by Modern Vet, pioneering surgeries and raising veterinary standards across the UAE.
Whether it is a dog with hip dysplasia or a Scottish fold, which we're going to come to in a few minutes, with joint deformities, we're talking about orthopedic problems. Mobility problems might be far more common than we might realise in our animals. But as we've been hearing, the good news is veterinary medicine is evolving really, really fast. We've got innovative surgical options. We've got tailored physiotherapy about helping animals really, in some ways, regain their quality of life and in some ways extend their quality of life. Dr. Moustafa is with us today and Megan Taylor from Modern Vet to talk about these breakthroughs and answer your questions too. Megan, you mentioned before when it comes to physiotherapy that you're looking at kind of acupuncture. You mentioned hydrotherapy. Debs has been in touch saying, tell me more about hydrotherapy. Is that something I could do with our old retriever in our pool?
So it's one of those things, you can swim in the pool, and of course it's going to give great cardiovascular health, and it's a nice form of exercise. But if it's from a point of view they have an injury or there's like something we're trying to treat, you have to think that maybe just the general swimming might not be enough, because there's a difference. Even if you see the dog swimming, they use their front legs mainly. They actually don't use their back legs that much. They're just kicking. So swimming is great for some things, but in some ways it's not maybe stimulating the areas you want to stimulate. So it's good for general cardiovascular exercise. Mm-hmm. It's nice for arthritis so that they can move their joints without any pain. But if it's an actual illness, it needs to kind of have like a prescribed treatment.
The tailored approach. Okay, now this is where I'm going to try and say a word, Dr. Moustafa, that I'm not going to get right, but I'm going to try my best for you. Scottish fold osteochondrodysplasia.
Yep.
Yes?
Yes.
Was that close
True.
enough?
Yes.
You know what I'm talking about. Not many cat owners will have heard of this. What is it and why does it affect this breed in particular?
This breed is unfortunately very common here in the region because they look nice.
Cute.
But this cute look with the folded ears is coming from a genetic problem of the deformed cartilage, which is not only the cartilage of the ear that's deformed, it's every single cartilage in the body. So usually we see a lot of cartilage deformities in the distal extremities, like below the carpus and the tarsus, like the rest and the ankle joints. And the word chondrodysplasia, it means that the cartilage is changed into a bone. So instead of having this smooth movement between a joint, it's actually a bone-to-bone friction, and it comes with a massive amount of pain. So this breed, particularly in the UK, for example, it's prohibited for breeding right now. So we want to use that we're here today with you, use this chance to send a message to cat owners that we need to reduce the inbreeding of these cats. It's really advisable to neuter them like really early in life and avoid inbreeding Scotch to Scotch cats, or if you really have to breed them, try to breed them to other breed like Bred Shorthair or something, which will reduce the flare-up of the genetic problems that we have. They come with a significant amount of pain from this disease.
Gosh, I never even thought about that. I knew about the, genetic, the cutesy look, and there was same with dog breeds that has, caused huge problems, whether that's through breathing or bones, as we're talking about today. But to think that it affects cartilage in every other part of the body apart from those ears, that's incredible. Does. Thank you
Welcome.
For raising awareness. Megan, when it comes to, if you had a little tally chart on a whiteboard in your clinic, which breeds do you see the most when it comes to physiotherapy? Dogs I'm talking about in particular.
For dogs, it will upset everyone, but the little French bulldogs. French bulldogs and Dachshunds, for the back problems, you need to be really aware that I think it's like 1 in 4 of them will have some kind of IBDD or back problem. And then everyone's most favorite dog as well, like Golden Retrievers, Labradors, they're really prone to arthritis, and quite early on as well, like from 7 or 8, they'll already have signs. Most breeds actually have something they're kind of predisposed to. So it's good to know what your breed is and the risk that it has. And you can kind of make those modifications from a younger age to kind of be aware of what they're at risk for.
I've kind of had my mind blown today to think about everything from 3D printing and prosthetics and braces and, and as you said earlier, Dr. Moustafa, this is a space that's evolving really quickly. We're having conferences here in Dubai where we're having, thought leaders and surgeons coming through and talking about the technologies, and obviously clinics like Modern Vet having specialists in place. For any pet owners listening who might be noticing any limping or stiffness in their animals, when should you seek specialist help, and why do you think early vet interventions can make a big difference?
I think it's something obvious for the pet owner to notice that their animals are not happy. It's not only limping, it's the change of the quality of life. Like as I told you earlier, they might not be happy to go out like they do. They might not be happy to climb stairs. They might not be happy to do the night zoomies. So it's not only the stage where they are limping, because this is quite late stage. If you have a dog that screams after sleeping or something like that, that's an obvious pain, but we're talking about some other hidden issues. At this point, yes, you should seek to see a veterinary orthopedic, because the earlier we diagnose the problem, the better the outcome.
Thank you both so much. As we've said, we've had, from the surgical point of view, orthopedic specialist Dr. Moustafa and Megan Taylor, veterinary physiotherapist there at Modern Vet. I would say head on over, because Megan's Instagram is a thing of heartwarming joy. It is, though. It's so cute to see animals, as you said, who've been given a prognosis of never be able to walk again.
And that's the thing. So many of them have been told, there's no put to sleep, or they will not walk. And it's so many of them just needed a little bit of help, and then they're fine. They just need something.
It requires a lot of patience.
And patience. You've got millions of views on your videos, and I think it really just connects this point that when we have an animal, it becomes family, and when you're dedicated, you can make such a difference. So both, thank you so much. If you would like the details of Moustafa and Megan, you can just send me the word. You can send me a dog emoji if you want, or send me the word animal to 4001 and I'll connect you. Thank you both so much.
Thank you.
Thank you.
Your ARN News. Good afternoon, I'm Andrew Hosey. The